Hi everyone. Today is Tuesday, March 23rd. It's Dr. Fortna with another COVID-19 update for you. I know it's been a couple weeks since my last update and boy has a lot changed. 2 weeks ago I was able to tell you that we had 0 cases in Hanna, and unfortunately we have peaked at 20 active cases. As of today we are at 19 active cases. It's important to know that there's a difference between the number of active cases reported on the Alberta government website and what that actually means for our community. So when someone develops symptoms of COVID-19, say they have a cough, a fever, a runny nose, it often will take them a couple of days before they contact the testing centers and then get their test and get their test result. So a positive test will be recorded on the day the test was taken on the system. But that individual may actually be on day 7, 8, maybe even 10 or 11 of their actual illness. So when you look online and it says 19 active cases, that does not guarantee that we have 19 infective people in our community. It means that we have 19 cases that have had less than 2 weeks from the date of their positive test. That also, if you look at the other end of that spectrum, means we may very well have people in our community who have just developed symptoms whose positive test is not yet recorded, but they would be considered infectious. I know we talked a lot about this at the very beginning of COVID last spring and summer, but a reminder that we consider people to be infectious with COVID from 2 days prior to symptom onset, all the way until 10 days after the symptoms come on. So if you happen to know one of the people in our community who was unfortunately infected with COVID and you see them out and about, you don't have to panic and stay away from them or yell at them to do anything, because what's going to happen is they've been outside that 10-day window. So they are feeling well and they're past the point of being infectious. I am grateful that most of the people in our community who have been infected have had mild cases. But a word of caution, I said most. Myself personally have sent people out of our hospital using the STARS helicopter because they are so unwell. That happens, and it's not always the people that you expect it's going to be. The people who are diabetics, overweight, with high blood pressure. Those people have a higher chance of having a severe case of COVID, but you can also get severe COVID in your mother, 65 years old, no medications, no allergies, healthy weight. We don't always know. That's going to bring us to our current rates. You'll see the number of 19 on there and maybe think 19, that's probably how many kids are in a school class. But when you look at the rate that is for our population, meaning the number per 100,000, we're actually in the top 10 in Alberta right now. We have more cases per capita than Calgary or Edmonton. That's concerning for me. We used to think that, going to the city was the scary thing, but knowing the number of cases that are in our community, that's alarming. So I want you to remember the really important principles. Wash your hands. We've talked about this over and over again. Either soap and water or alcohol-based hand sanitizer will kill the COVID virus if it's on your hands. If you are feeling unwell, a little bit of a sniffle, if your nose is running a bit, you've got a bit of a cough, you feel like you woke up with a bad headache and you're feeling achy, please stay home. That's the time to say no to visiting the nursing home. If you answer questions at the clinic, you answer honestly, saying that you're unwell and we just put you in the COVID room. It's the time to not say, maybe I'm going to get together for a branding experience. Really be responsible if you can. On to vaccines. You may have heard that the AstraZeneca vaccine, which has come out, the viral vector vaccine that was for people between the ages of 50 and 64, has been given through public health here in Alberta, but all of it has now been used up. People have booked appointments for all of the vaccine that we currently have. There are plans to obtain more of this vaccine, but there's no appointments being booked now because we don't want to book people and not have supply for them. So for those of you that were hoping to get that AstraZeneca vaccine, you're going to have to wait a little bit. The people who are over the age of 65 are still able to book a vaccine for themselves using the mRNA vaccines, and these can be booked either through our local pharmacy, the PharmaSave, not Anderson, or it can be booked through the Alberta government website or by calling 811. This is for the people over 65 only. As subsequent groups become eligible for vaccine, you're going to see lots of advertisement about the age category and how to do it. But we just don't want to book people until we have enough vaccine for them. I did get a good question asking me about whether or not people with comorbid conditions, so other diseases, may still respond to the AstraZeneca vaccine. All the information that we're giving you is either going to be from the formal research study, which is published and peer-reviewed, or it's going to be from real-world observational data. Initially, the stuff that came out in December told us that the AstraZeneca was pretty good vaccine, but the population it was tested on was healthy adults between 18 and 65. Eventually, they extended that up to seniors and some people with comorbid conditions such as obesity, high blood pressure, heart failure, diabetes, but there wasn't enough people that had those medical conditions or the advanced age for us to tell you with certainty that it worked in that group. Now, if we look at the real world data coming out of the UK, where they've been giving it to seniors and people with those conditions for a long time, it's been working just fine. So for those of you thinking, maybe it won't work for me, I would say you're pretty confident to be able to get the AstraZeneca if it becomes available again. It's expected, as you know, that all adults between, of course, 18 and up will be eligible to get their first vaccine before the end of June. That's creeping up surprisingly quickly. So you'll have to make a decision whether you want to wait for your category to come up for one of the mRNA vaccines, or if you want to get the AstraZeneca when it comes out. My theme is always going to be the same. If you're uncertain which vaccine is best for you, please talk to your family doctor. Now, side effects from vaccines. So it's really normal and common for you in the first couple days after your vaccine to have a sore arm. It's going to be a little bit red. It might be swollen, or right under your armpit where you have lymph nodes, those can get enlarged too. It is not a sign that you have COVID-19. You cannot catch the disease from the vaccine. It's not possible. Some people will also develop a fever. They may develop muscle aches and pains. That's a normal response, and it's a sign that your body's doing what it's supposed to do. It does not mean that you are infectious with COVID-19 disease. There is also going to be a 7-day itch, as we call it, for some people, where you get your vaccine, say on the 1st of the month, and then 7 days later on the 8th of the month, you might say, I was feeling pretty good. Why do I have swelling again in my arm? That's okay. It's just the way your immune system works. We're also finding that people are having a stronger sort of side effect response to their second shot. So for those of you who are getting a second shot at the 2-week mark, or at the 4-week mark, be prepared that your second one might be more severe. You might find that you have 2 days of fever. I just felt really tired when I had my vaccine for a couple of days, but nothing that wasn't manageable. So don't plan any big things around that time, other doctor's visits or trips into the city for shopping, anything like that. Just plan to be home kind of relaxing around your vaccine. I think that that's all I have to list for today. I did get a question asking me about whether or not the cases in Hanna were variant cases. That data is not available to me. Starting on March 18th, any positive COVID case is going to be tested for the variants, and that's going to be reported to the family physician, but only from the 18th and onwards. So I cannot access data that other family physicians have patients for. I can't do that. It's a privacy rule. And so I only know from my patients, and I can't publicly tell you that on a video. If anything becomes publicly aware that I can find, I will share that with you. But for now, we just have to say I don't know. So until next time, stay well, wash your hands, and I'll be in touch.